postpartum. So right after I gave birth to him, I had a great experience with a lactation consultant, and she inspired me to go back to school to go into nursing and then ultimately to become a lactation consultant. So that's my nursing background.
Okay, so we're gonna just go over a little bit about what the NICU is and kind of specifically what we do here as nurses. A lot of people think in the NICU that we just have premature babies, but that's not true. We have a lot of premature babies, but we also take care of term babies that just happen to be sick in one way or another. We also have babies in here that need surgery of some kind. Let's see. So some babies can be here for months, and some babies are only in the NICU for hours, and then they can go back out with their parents. As nurses in the NICU, we can take care of anywhere from 1 to 3, occasionally 4 babies, but it just depends on how sick the babies are and how much one-on-one care they need. As a nurse in the NICU, you could have just a regular patient assignment, which is often what we do, but also there are other opportunities. Some nurses in the NICU go to high-risk deliveries. So they would be there when the babies are born in case they need resuscitation of some kind. There's lots of committees that nurses are a part of. So there's going to meetings. There's like lactation, like Sabrina does. Some of our nurses are on the transport team, which Adriana will talk about a little bit more later, but they go out to smaller outlying hospitals in the community that don't have NICUs, and they bring those babies that need NICU care back to our hospital. Yeah, so just a variety of opportunities as a NICU nurse for things for you to do.
So in our NICU, there are about 100 NICU nurses. We kind of split our shifts between day and night shifts. Most of us do 12-hour shifts. We take care of, I think there's 36 patient beds here in the NICU, so we can take care of quite a few babies from the community at once. For our L&D department, I think that there's an average about 2,000 to 3,000 babies that are born every year, and about 550 to 600 of those kids actually come into the NICU and need some kind of support from us. And then out of those 550 to 600 kids, 100 of those actually come from our neighboring communities. So we on the transport team, the team consists of 1 nurse and 1 RT, and we go to outlying hospitals and pick up babies. So we go to Florence, Newport, Coos Bay, Roseburg. Sometimes we even go down to Medford, Lebanon, Albany, and Corvallis. And that's kind of our area that we specialize to go pick up babies and bring them here and give them the kind of care that they wouldn't be able to get at the hospital where they were born at. Also McKinsey, we do pick up babies from McKinsey. And when we do that job, we are given special training so we can give life-saving procedures for the babies while we're taking care of them. And like Sarah was saying, there's also, there's different roles that we have here in the NICU. So we also have like a charge nurse that kind of helps, take care of the staff and making sure everything kind of runs smoothly. And both me and Sarah do that job. And so one thing that I've really always enjoyed about being a nurse is there's always room for growth. And the other thing that I kind of talk to when I'm talking to people who are interested in the nursing program is that it's also a job where you're always like having personal growth and being pushed out of your comfort zone. And there's always something that you can do. Sabrina came in and was a bedside nurse and did that for many years. And then she decided, I want to do this other thing. She was able to get education and do that. So that's the one really like big pull of nursing for me too. When I was trying to think about what career I wanted to do is there's so many ways that you could go as a nurse, even in the NICU in one specific unit. There's a lot of different jobs that we can do. We take care of all different sizes of babies. The smallest baby that we've taken care of here in our NICU was about 3/4 of a pound. So a normal baby may weigh 7 to 8 pounds. So if you think about a carton of butter and they come in a little 4-pack, if you were to take 3 of those and shape those into a baby, that's how small baby Phoenix was. So super tiny. And then the biggest baby we've ever taken care of here at the NICU was 14 pounds and I think 4 ounces or something like that. So almost double what a normal baby would be. So we have a big variety of babies that we take care of. And we had a couple little prompts here that you can just kind of see the size. So this would be a normal size diaper. And then we have one that's kind of like a medium size for some of our smaller babies. And then we have a super tiny one. So you can just get an idea of of how small we're actually talking that these kids are. And then if you guys think about a blood pressure cuff, what that looks like that you would put on your arm, and then we have this little one. So this would be our tiniest of babies, and that would be how big their arm or even sometimes their leg would be. Sabrina, do you have anything to add about the NICU? I guess I can show you guys some of our equipment real quick. I'll flip it around. So this is our incubator. So those really small babies can be in there and get all the support that they need. And even the big babies we can deliver and bring to this bed and give them the care that we need.
I was just going to add that the really awesome thing about working as a nurse in any department, not just the NICU, is that every single day that you come to work, you meet a different person, you have something new that you may have never worked with. A lot of it is repetitious, but there's so many new things that you learn every day and different experiences that you have every day. So it's a really dynamic job, and you really never know what to expect when you come to work. So it's very exciting, and it's also really nice that you have a large community of coworkers that you get to know and work with over time and develop relationships. So there's so many things about nursing that allow you to grow as a person, personally and professionally. So that's something I wanted to add. And then, like Adriana and Sarah were saying, you can really choose your own path because there's so many options in nursing. You can be a NICU nurse, but you can also be a lactation consultant, or you can be a manager, or you can become a nurse practitioner and do more of what the doctors do. So it's just never-ending possibilities and opportunities, and it also doesn't take very long to become a nurse. It's, you go to school for a couple of years to get your prereqs, and then a couple of years to become a nurse. So it seems really achievable for a lot of people. And then the other thing I wanted to mention is just the flexibility of hours. So you can work 8 hours, you can work 12 hours, you can work Monday, Tuesday, Wednesday, Saturday, Sunday. You have so much flexibility. So it's really a family friendly type of career as well. So it's really appealing. And that's what kind of also drove me to the career, is just the flexibility and the different options. So.
Yeah, I saw that there was a question and somebody asked, I think I mentioned that the two people that go out on the transport team was a nurse, a registered nurse, and then the RT. And the RT is they're respiratory therapists. They're actually registered respiratory therapists. They actually have the same length of training as an associate degree nurse would have. We had a program at LCC that you could actually become a respiratory therapist. So they basically deal with what you would think of your respiratory system. So lungs, airway, breathing. They're a really big part of our team in the NICU. And I don't think they have a school at Lane anymore, but I think they still have schools where you can become an RT in the state of Oregon. Does anybody else have any other questions?
So students, if you have questions, could you could just write them in the chat right now. And then at the end of the presentation, I'll stop recording and we can do just an open communication flow back and forth. But right now, if you have any questions on what's been presented so far, write your questions in the chat. Thank you.
I saw that someone asked what they can be doing now to prepare. I did a health careers class when I was in high school. That really helped. I think we even went to the hospital a couple of days and got to see some different areas and see what our interests might be. That's probably not possible right now, but so aside from that, I just did a lot of research into what schools in the state offer a nursing degree. There's your associate's degree, which is a couple years, and there's your bachelor's degree, which is a total of 4 years usually. The hospitals all around the state, probably the country, are really wanting nurses with bachelor's degrees nowadays. So just really looking for schools that offer a nursing program and just what their requirements are. I highly suggest going to a community college for your prerequisites, just for the cost saving of that. But, and you can easily transfer to a four-year school to get